like Joey said, we're going to be talking about the air we breathe today. As a disclaimer, this talk has been brought to you and sponsored by Leo Steph Healthcare. You can see they stand directly behind you. Okay, so why are we talking about this? And why is the air we breathe this important? The atmosphere that surrounds us is becoming more critical of an issue now than ever before. And before we talk about why it's important and why it affects us, let's first look at what air really is. Essentially, it's something we can't see, so we often bypass it as just one of those things, irrespective of the impact it has on us. But literally, air is composed of a number of gases, the main one being nitrogen, obviously oxygen, and then we've got other vapors, carbon dioxide, and many other gases included. Now, this is really, really important because with time, these concentrations and these percentages are changing, and we're seeing the effects of that. Now, anybody who lived in Cape Town in the last 2 weeks would have experienced this. When we had this ship from Kuwait, the Al Kuwait ship that docked at our harbor, literally for 12 hours, there was this incredibly horrendous stench in the city, and nobody could breathe. And we were all then awakened to the fact that a smell or a decrease in quality in the air really is something that's really, really critically important. So before the Industrial Revolution, in the 10,000 years preceding to development of industry, right, to put things into perspective, if we go back to how the world and the earth has revolved, carbon dioxide levels in the air had risen by 10%. So in 10,000 years, 10%, that means for every 1,000 years that human beings walked earth, our carbon dioxide level increased by only 1%. But since the Industrial Revolution, in literally just that period between 1700 and 2018, our carbon dioxide levels have increased by almost 50%. Now that's massive, absolutely, absolutely massive. And while we're taking a look at history, the atom bomb, because of the movie that was recently released, and I'm sure you saw one big at the Oscars, was given a highlight again. But right back from the Second World War, the impact of what the air does on human beings, on our human health, and our breathing has been highlighted. So with Hiroshima, apart from all the other negative impacts, like if you look right at the bottom, and this was something that I myself was surprised to find, and I never knew until I researched it for this talk, but the number of doctors and nurses in Japan in that period dropped from 200 to 20, and the number of nurses in Hiroshima dropped from 1,780 to 150. So apart from the human capacity, right, for years, this was for decades and centuries later, hair loss from heavy radiation exposure was something that was still being experienced. People were seeing effects of radiation sickness in their bone marrow, which was proven as a result of the atom bomb and the atmospheric damage, as well as on the colon as well. And now we look at leukemia. So if you look at the red arrow, which I've highlighted there, that was the people who were most closely, in terms of the diameter around the surface area of the bomb, the most closely exposed, and the leukemia levels almost tripled. Almost triple your chance of developing cancer of the blood if you were that much closer to radiation exposure, which meant that this was an environmental impact. So in the USA, because of the Clean Air Act from 1990, now obviously we can't compare ourselves to the USA because it's a developed country, there was a massive change in the behavior. I'm not going to say there was a change in the actual levels that was significant enough, but there was a change in the behavior that we do actually need to now look at air and look at the atmosphere and try to reduce industry emissions. But this is a photograph taken of Johannesburg. I'm not from Joburg, so I didn't want to show a name of any factory, but this is a photograph of Johannesburg, and this is now almost 30 years after the Clean Air Act. If you woke up at 4:30 in the morning in the city center of Joburg, this is what you would see. So now if we look back at what is air, right, it doesn't look so much like that anymore. It doesn't look so much like our carbon dioxide and our carbon monoxide levels are going to be 1%. Certainly because of this, the levels are going to rise. And we all feel it. Everybody thinks that, well, we read about climate change, we hear about climate change, but how does it impact us? Everyone who was here in Johannesburg this week has experienced. I mean, I've never experienced, I'm not sure if it happens regularly here, but I've not experienced the kind of humidity and heat that I experienced this week. So anyone who argues that climate change and the environment and air doesn't in fact impact us, not only is experiencing it themselves, but here are the facts and the figures, right? Temperature anomalies, and this is in the last century. So if you just look at, I think this graph is pretty self-explanatory. Our patterns have increased dramatically. And this looks at right from the 1975, 1980 times, right? They have always been fluctuating. But if you look at that period, this is the period where we were building more industry and our businesses were thriving more, which of course is good for the economy. But I'm going to show you how climate change and increasing emissions is bad for the economy as well. And in the African continent, when you look at the average frequency of heat wave exposure, we in the southern tip of Africa are between the high to extremely high region, meaning that not only are we experiencing climate change like the rest of the world, we are also experiencing it at the highest level. Again, global trends. And this is something which I found quite interesting because generally we say that developed countries would have higher temperatures because developed countries are obviously producing more coal. Developed countries have more factories. But globally, they have actually had lower levels than we did in South Africa. And this potentially was due to the fact that there is more awareness and there is buy-in from companies. And in terms of the impact that climate change has on your health, I don't want to go through all of this. This was a paper which was published in 2020 in one of the Allergy Immunology journals, which is my background, which is why it's of big interest to me. But if we just look at two of the key things here, right, and that's what I want to talk about today, is respiratory diseases and infectious diseases. Climate change has a massive impact. So I can tell you from my personal practice, because as an allergy immunology specialist, we treat asthma and we treat people with allergic rhinitis. But as a general pediatrician, we're also treating recurrent upper and lower respiratory tract infections. And often in my practice, every day I get patients coming to me saying, but why are we seeing so many infections now? Why are we seeing so many allergies? And here's the thing, is that allergies and infections were around on the planet for as long as humans inhabited the planet. In fact, viruses were probably around in the dinosaur era as well. The problem is that we're now living in a time where our immune systems are not as well equipped as they were previously to deal with them. The quality of what we're putting into our nostrils, which means what we're putting into our lungs, and the quality of what we're eating has deteriorated, so that renders our immune systems weaker, but also in general, the nature of the viruses have changed. And this is why we all really need to wake up and try to be more proactive about what we do, in the environment as citizens, but also in our own homes. There are many viruses that I'll tell you about, but seasonal flu is one that literally, I think if I said by a show of hands here, every single person here would have had the flu. I'm sure if I asked you in the 2.5, 3-year pandemic, how many people have had COVID, everyone either has had COVID once or more times or has had a family member who's had it. But seasonal flu is something that even if you've got kids in your home, so toddlers would develop it. But the flu is actually not a bad thing. We've never said that having a virus is a bad thing. The issue is how your body deals with the virus and how that virus then impacts your quality of life and has a long-term impact on whichever part of your body, be it your respiratory epithelia or your immune system as well. And these are US statistics because we don't have really amazing statistics in South Africa recently, right? 4 million hospitalizations. And like I said, this was done in USA. They say worldwide, but I can tell you that Africa wasn't counted there. And we admit kids with parainfluenza and influenza viruses every day. 87 billion US dollars that are used not on cardiovascular disease, not on people with heart attacks, not on people who have pneumonia. This is just from influenza and parainfluenza. So when we look at simple things like influenza, I often like to say when people even today come and ask me about COVID-19 and say, well, you know, I've got infected with this. And thank you. If you see the word influenza, all of these are airborne, right? RSV, and it's now, forget what the date is, it's the middle of March. So when we get towards end of March, April, we used to see RSV, and we said it was RSV season end of May, beginning of June. But I can tell you post-COVID, and there's various theories for it, possibly because schools reopened after being closed, and that first year where everything was completely open and mask-free in schools especially was last year, was now we're seeing our RSV/influenza season much earlier. It's being extended. So in that extended period, we're finding that people are testing positive for RSV as early as March and April. And I'm sure all of you, and if any of you are running your own practices, you'd know you are seeing people, even now in summer, coming to your practice, presenting with flu symptoms. And if you send off that swab, influenza is coming up positive, which is not common. It's not common to see that in December, January. It happens, but it's not really common. Your coronaviruses, metapneumovirus, Boca virus, adenovirus. Adenovirus is a silent killer. And I mentioned coronavirus there. I chose a slide with coronavirus because a lot of patients get terrified now when they see a swab. And I generally don't swab unless it's indicated or I'm worried. But generally patients see the word corona now and they get terrified, right? Coronavirus has always been in the world. I have been treating people with coronavirus from the time I was an intern in King Edward Hospital. We used to treat people with coronavirus in rural clinics as well. The problem with coronavirus in 2019 was that particular strain of coronavirus that went and affected people. Another important source of problems in your respiratory tract is bacteria. And if you look at the number of deaths, the one that we see most commonly in South Africa is strep pneumonia, right? And basically now that we talked about coronavirus, just very simple concepts, just the top two that I want to mention, and this is why viruses are now a bigger issue than they were before, is a concept which we call antigenic drift and antigenic shift. And basically what they say, and don't stress, I can see people straining their eyes trying to read that, don't stress about, basically what it tells us is that the virus is changing its personality slightly. In the drift, it's not really changing its personality. In the drift, it's basically changing its clothes. This is how I explain it to patients, is it's changing its clothes, which means that part of the outside are changing slightly, but it's not that we can't manage it or that our usual medication, our usual therapies are not going to help you. But when it goes through a shift, it's changing from the inside. And when it changes from the inside, it means that all the usual stuff that we use is not really going to help it because the core of it has changed slightly. And that's essentially what we saw. We all were terrified when the pandemic came about, but the world's been dealing with epidemics and pandemics for as long as human beings are on Earth. And we will continue to deal with pandemics for as long as human beings continue to stay on Earth. It's just a question of how do we as human society manage these things, and how do we personally equip ourselves to make sure that this does not cause an issue to our quality of life and does not cause an issue to our long-term health as well. I don't want to bore you going through everything, but literally, I mean, the pandemics in the past, and we've all heard stories about Black Death and about the various plagues. There have been a number of plagues, but they have killed millions, literally millions and millions of people. I think one of the ones that we most recently used to talk about during COVID-19 was the Spanish flu, but a big killer in our century was also cholera. And in terms of influenza epidemics, not necessarily pandemics, we heard about all the different strains, but essentially the principle was the same, that the strain actually changed the way the genetic material functioned, and this now would impact human health. This is from Nature, the Nature Journal, which is probably one of the highest impact factor journals, and I think it's from 2021, yes, where they looked at the global burden of infectious diseases. And this was published after or during the third wave of COVID-19. And if you see there, Africa is sitting with the highest number of deaths. So even though we thought in Africa, wow, we handled COVID-19 like a bomb. We did so well because compared to the stats we saw in USA and compared to the stats we saw in many other countries, we did so well, but we've still got other things to worry about. We before COVID-19 had bigger fish to fry like tuberculosis and other viral illnesses or other illnesses that depress our immune system, and that creates a huge impact on the percentage of lower respiratory tract infections we have. I'm sure most of you have seen this picture many, many, many times, but just to show you the similarity between influenza and coronavirus, essentially it's a ball that's surrounded by a membrane, and that membrane has got specific features and characteristics. And when we want to treat anybody with the flu, like we did with coronavirus, what we want to do is we want something that effectively penetrates that membrane so that it can treat that genetic from inside, or something that can neutralize that membrane so that from the outside that is no longer going to affect us in any way, right? This is just a bit of history for how long ago the human influenza virus was isolated as well. Really, really important to know, you can't kill a virus, right? Most patients that come to your practices will come to you with viral infections 9 out of 10 times. And most people want a quick fix. They want to feel better. And when specialists say to them that, you know, an antibiotic is not recommended for you, you need to treat, or I'm going to treat your symptoms, most patients want this virus to be gone. So as healthcare professionals, whether we're pharmacists or whether we're doctors, because people with viral infections seek health from all avenues. Most of them, in fact, and this is another bit of research I did, will go, their first port of call is a pharmacy. Is most patients want a quick fix? And the answer is no, it is not a quick fix. And a virus stays in a person's body for at least 4 to 8 weeks. So usually when patients come to me or email me after 4 weeks and say, oh, we're feeling a bit better, but we still have X, Y, and Z, I say to them, or especially with babies, that virus is still in the body. That virus is still there. It doesn't mean that you're still going to be necessarily badly sick, but that virus is going to stay in your body. But the point of my talk today, and this is one of the messages I want to drive home, is when that virus is there, what we want to do is we want to get our environment and our immune system in such a way that when we are basically down, when you've got a virus in your body, your immunity is not at a baseline. So that means that you're more likely to pick up other viruses. This is difficult for us to really pinpoint, but this has again been done with research, where somebody has influenza today, goes to the doctor, gets some treatment, gets better. 3 weeks later, they get a swab done, and now 27 viruses are isolated. They don't feel better because the same virus is still there, and I wouldn't intervene unless there's an issue, like closed airways, or unless there's a specific issue, right? 2 weeks or 3 weeks later, some other doctor, because patients tend to go pharmacy shopping and doctor shopping, somebody does another swab, and now there's 48 viruses present, and that person thinks that I'm getting worse. But what's happening is when you already have a virus in your body, your immune system is not at its normal baseline. It's at a lower baseline because it's busy fighting this virus. So it's more likely to pick up other viruses as well. So when we tell patients you can't kill a virus, it's important for us to also know with patients and educate them that improving your immune system, or knowing that that virus might still be there and it's not going to go away, really does empower them or go a really, really long way. Just some statistics, again, like I said, in terms of coronavirus, it's in a modification phase, right? But it's lost its mortal danger, right? And again, this just looks at mortality rates, right? And if you look at where we are in Africa, with deaths from respiratory infections, this was in 2019, and this is World Bank data. We're sitting somewhere around in the middle sector of the world. So again, if we compare, and I didn't make a slide on that, if we compare how badly we were affected by the pandemic compared to other parts of the world, we did well, but we are still sitting in the middle of the world in terms of the number of people that are dying from other respiratory infections, right? And some of the important things in terms of how the environment impacts the health, respiratory system, COPD, which everybody knows about, asthma, which is my particular interest, pneumonia, as well as lung cancer as well. This was a paper that was published in our allergy journal by our European Academy, where we looked at how air pollution impacts, indoor air pollution impacts health in general. And I'm just going to quickly run through this so we have time for questions. Is literally, we looked at during the perinatal period, adulthood, lifelong, and some of the key things here were higher prevalences of asthma, higher prevalences of allergic rhinitis. If you already had a genetic issue, you had a higher risk of having worse asthma and worse allergic rhinitis, and you also had higher rates of sensitization to specific things in the environment if your indoor air quality was lower, right? And this goes to house dust mite, it goes to mold, and it goes to pet dander as well. In terms of exposure levels, these are statistics in the EU. I'm not sure if you'll be very interested. I think one of the guests here who's here from the EU might be. But as a planet, we are far away from what the UN has set as targets for us. We still are sitting at more than 75% exposure of everything, PM 2.5, PM 10, our NO2 levels, as well as our sulfur dioxide levels. And just graphically to represent how essentially your PM 10 particles, this is not even PM 25, so these are things that are 10 micrometers and smaller, enter your epithelia, you then get basically an inflammatory reaction, you get increased mucus production, and that then can either make you sick or it can exacerbate an illness that you already have. And if you're a smoker, really, really bad for you. Really, really bad for you. Now, approaches to flu protection, because, and I thought flu would be important because we now pre-flu season in South Africa. We all know about barrier prevention, immune stimulation, and this is basic things which we use, even things like supplementation to improve our immune systems, vaccination, which I think is a separate topic altogether. I'll need a few hours for that. But what I want to introduce you to today is innovative high-tech approaches. Now, as an immunology specialist, we're constantly looking at ways that we advise patients to improve the environment. And every day I get asked by patients on, if I'm allergic to this, or if my kid keeps getting sick, what can I do? I just got an email sent to me at UCT today where this mom says to me that I moved from Johannesburg, I'm now living in Cape Town because I thought that the air would be better in Cape Town, and that's what my doctors told me, that I should move here, but my child is still getting sick. So patients are really desperate. Patients will do anything. If there is a family member who's getting sick all the time, if there's somebody who's coughing all the time, if there's somebody with asthma, somebody with allergies, patients are looking for ways. I can't tell you how many of my patients are constantly asking me about importing stuff from overseas. There are patients who send me brochures of very, very expensive humidifiers and dehumidifiers. Patients are importing vacuum cleaners, and I'm sure you all as healthcare professionals are getting all these ads for all these companies that are going into people's homes, busting mold, busting house dust mite. This is because this is what people are looking for, and this is what people want. And especially post-pandemic, people are really looking to how can we prevent this in our family, and how can we highlight the fact that the air we breathe needs to be better. So basically what this device does, and this is one of the devices that has been well researched in the EU, is it reduces the amount of viral particles without releasing chemicals. Now from my side, and this is not something that anybody's told me, this is something that I research on my own, is for me something that does not emit chemicals into the environment is very key. Because a lot of people buy things from shops and they buy things from Take-A-Lot that says anti this spray and anti that spray. When you bring a spray into the environment, you're putting a spray into the environment. That's literally what you're doing. So you're actually releasing some form of chemical that's going to kill something. What we essentially always want is to improve humidity. That really helps, especially for people who live in Gauteng. But you want to be able to, because you can't kill a virus, you want to be able to neutralize a virus. And what technology like this does essentially is it looks at, and that's why I showed you the picture of what a viral particle looks like, is it looks at the genetics of what the makeup of the virus is. Each virus is different, but what we know is each virus has RNA and some have DNA as well. Each virus will then have different elements in it, be it calcium, magnesium, some of them might have copper, platinum, sulfur, whatever it is. If you can neutralize, meaning that if you can now somehow decrease the capacity of those basic ions in the virus that allow it to thrive. You're not going to kill the virus, you're not going to stop viruses, but you're going to prevent them from thriving, because viruses thrive in environments that viruses like. And viruses like environments that are dirty, viruses like environments where human beings are breathing, viruses like environments where human beings are sneezing and coughing all the time. But if you're going to do something in the environment where, and sorry, most importantly, viruses like environments where other viruses are living. So if you can kill even 20% of the number of viruses in a specific environment, you're already decreasing the what can I say, conducible environment in which a virus can thrive. And essentially what we're looking at is positive and negative ions, and positive and negative ions which work against each other, which prevent that virus from catching on into the environment and functioning properly, right? So basically cold plasma, like I said, is something that has been used for pollution in lots of studies, in allergy, from my perspective, in patients with house dust mite allergy. And what it does is, you're not going to see it with a human eye, but what it essentially does is it helps to emit the right things into the environment, so you're getting that humidity in the environment firstly, but also with the ions, you're getting a positive and negative charge, which neutralizes the virus or any particles from inside and decreases the load of them. Okay, so a lot of people that might say to you, well, why should I care, right? I got coronavirus 10 times, I didn't die, I was fine, I don't really need to do anything. Preparedness works. I showed you how the World Health Organization has now documented that we are ill prepared. Health is everyone's business. Whether or not the next pandemic kills people on the planet is actually something that all of us need to be considering. No one is safe until everyone is safe. This is a tagline that we as healthcare workers used all the time. Our response needs to be agile and adaptive, and the world is changing. Climate change is real. The next pandemic will come. We don't know when, but it will come. We have to look at many ways, not just one, but many ways to protect ourselves. And the environment affects us really, really, really in every way. I literally touched not even the tip of the iceberg of all the stuff we're doing on environment and the environmental exposure and how it impacts asthma, allergic rhinitis, immune systems and immune deficiencies, as well as people's responses to viruses. But I can tell you that the data is real, and this is definitely something that we all need to start thinking forward towards when we treat patients. Thank you so much.